Welcome back. This is part 2 of the series I'm doing on breast surgery revision, right? What are the reasons why breast revisions may be necessary? What are the reasons for various types of surgical things that are done for breast surgery? And in each category, what are the reasons there may be some revisions? I want to start off by saying, right, revision is not bad. Revision does not mean something went wrong or something was botched. Revision could be just staging operations to get the best ultimate long-term outcome. Revision could be because something changed. Revision could be because somebody changed their mind, or whatever the case might be, but it doesn't always have to mean that something was wrong or whatnot, okay? Just make sure that I get that across to you guys. So last time we talked about augmentation and some common reasons for doing revision surgery. Let's do the next one on the list, which is a breast lift. Okay, for a breast lift revision, this may be a very hard number to put down. What is the likelihood of somebody needing a revision for breast lift surgery? I don't know if there's going to be ever an accurate number for that, because a person who wants a lift may want it for various reasons, right? They may want it because their nipple is pointing, to the ground, or because all of their volume is at the bottom. They want a little bit more fullness at the top. They may not want an implant for whatever reason. They may already have enough tissue. They just want it to look better or higher. Any number of reasons. Their breast tissue could be very soft. It could be very glandular and has enough structure to hold a shape. Many reasons. Their skin could be good and elastic. Their skin may not be good and elastic. And inelastic, right? So we need to know these categories, and then we need to further understand the revision rate for each of these subcategories, so you can't lump it all together. So it's hard to give a number, but whatever the revision need is, what are some reasons why somebody would want a revision? Well, let's just say a patient comes in and has their mindset on the fact that they don't want implants. They just want their nipple position to be more centered because it's pointing down. Completely reasonable choice, right? Reasonable request. It can be done. And compared to that look, lifting somebody is going to make them definitely look a lot better. But that person may not think about cleavage, for example, may not think about a certain look of fullness. They just are focused on the nipple position because it's pointing down, I want it higher. Well, that's what they're dead set on, and that's what they want to do, and that's what the lift will accomplish. However, after looking better, they may feel like, oh, you know what, I wish I had some cleavage and some upper pole fullness, upper pole meaning at the top, where when I wear some clothes, I have some shape. That may happen, that happens frequently. And then they may come back and say, well, doc, I like the way I look, but I want to look like I have a better shape. If that's the case, then you may want to put an implant in. That could be a reason for revision, right? Add implant. Okay. The second reason is, well, they look generally better. They definitely don't want an implant, but for the same reason, they want some additional volume somehow. You could do fat grafting there. Right? That could be a reason. The third reason could be that their scar didn't heal well. For what, again, unknown reasons, but sometimes it happens, right? Even though meticulous stitching is done of the incision, sometimes the scars just don't heal well. So it could be because of bad scar. Many times when you do a breast lift surgery, you're almost always working with the nipple, right? You're moving it or positioning it in the right position. If that's the case, you inevitably have to cut around the nipple areola complex, or the nipple, right? Most people refer to it, but it's actually nipple and the areola, the skin around it. When you work on it and dissect and cut around it, sometimes it looks a little too stretched, and there could be some asymmetry, right? The scar could be stretched, again, that goes in here, but asymmetry, where the nipple and areola size may look different. Size, which people don't obviously may care for. They want it to be symmetric. And secondly, the breast size itself may settle down differently because one side heals a little bit better than the other. Because again, remember, breasts are supposed to be sisters, not twins. And especially people who have issues already to begin with, it could be more of a reason to kind of keep that in mind. And I always tell patients, or at least I think about it in my mind, that you might as well do this surgery on two different people, because you may have to do one different operation on the right side and a completely different operation on the left side, because they are starting out with some different problems, right? Different situations. So it could be because of asymmetry. It could be because of, how should I say this, fluid collection, or maybe some fat or some tissue creates some inflammatory, some hardening in some areas. It's possible, not likely, but possible. You may have to go do some cleanup job because of that. But that's rare and uncommon. The more common reasons are these, right? So even in breast lift surgery operations, there may be a need for a revision, and the more common ones are the ones that are listed: to add an implant, add volume, do fat grafting, scar revision for various reasons, and asymmetry for some, that just looks a certain way. So keep in mind that these are evolving decisions that happen in a person's life, because if a person starts their journey to kind of do some things for themselves in their 20s or 30s, their thinking may change in their 40s or 50s, or vice versa, right? They may have thought a certain way when they were 20 or 30, and then now they're older, they may think differently and they want to do something. So these surgeries, called revision surgeries, are a good thing if it's thought through and explained transparently, so that the person understands the natural evolution of all of these operations and what to expect 2 years down the road, 5 years down the road, 10, 15 years down the road. Okay? So my goal with these series of videos is to simply educate you with that perspective in mind. Thank you.